Good day everyone, I'm Mikey Bastillas and today I'll be demonstrating you guys how to do a eye assessment. Before proceeding to the basic eye assessment, you must prepare the equipment so that you can save some time and energy and also determine the scope of assessment that are needed to prepare the necessary equipment so that in order to know the extent of your precision assessment. Number 2. Always do proper hand washing so that it will prevent the spreading of microorganisms. If ever so, use gloves in doing the eye assessment. Greet the client and introduce yourself politely and explain to the client what are this assessment for and explain to the client what are the procedures that the client must do. Good morning sir, ako si Miguel Bastilla. So ako yung student nurse for today. So sir, karon adlaw sir si examine na ko imong mata. Naon na kung if na may problema imong mata or di ba kita or hanap bang pan-aw nimo. So karon ako na examine karon sir. So imong bato karon sir is magtabon tas imong mata sa kan later niya tatabon imong mata niya o makaklaro ba imong pikas sa imong left band o sa right. Then gamit nita sa kuan light pen din at tutanawon imong mata if makaro ba imong hayag. So, okay ba tayo, sir? Number 4. Before proceeding to the eye assessment of the client, always provide the client his or her privacy and make sure the client is comfortable around the surroundings. Sige sir, magsugod ta sa imong assessment. Ako nang sa portahan para magsugod ta sa imong eye check-up o ang rason po din sa portahan is para comfortable ka sa arong examination o wala pa disturbo. Number 5. Always check the patient or ask the patient if she or he was wearing glasses or any contact lens. If ever she or he wear glasses or contact lens, it's okay to wear them as long it's not a coefficient to the eye test procedures. And now then, if the patient is wearing a reading glasses, always to take them off before proceeding to the eye assessment so that there will be no coefficient. Sige sir, magsugod na ta sir sa assessment of eye. So, sir na po ta sir if nagasuot ba contact lens sir or glasses na grado? Wala. So since kay wala man, kay wala. So magsugod ta sa kuan sa vision nimo sir. Tama to if makawali mong eye chart. So palihog lang tindog lang sir. Number 6. Help the client stand from 20 or 6 feet away from the eye chart. Then tell the client to cover his or her eye so that he can begin the test. And tell the client to read the letters in the eye or F chart individually until the client cannot decipher the letters. Sige sir, kaya since kayo may problema sa mong mata, so magsugod na ako sa eye check-up nyo sir. So, ang unang buhaton sir is gamitin na natin sir, tabunan natin yung mata sir at makaroon mo ang eye chart. So ang button sir is muna ang right, itabon na ang left. So muna yung button. So once matabunan yung mata, imo din basahon na yun if makaroon mo ang kuan ang mga letters sa imong left eye or sa imong right eye. So yes sir, start na ta. Number 7. Take the two readings, the left eye, the right eye. Sige sir, pag-iikuan na sa mata sir. Sige, basa lang ko sir. Klaro sir.
A F P T O Z L P E D.
Tigas mata lang po sir.
E F P T O Z L P E D.
Sige sir. Number 8. Perform the selective vision test, which is there are 3 types of selective vision test, which is the light perception, hand counting, and hand signs. Sige sir, pila minutes sir?
1,
Kani sir?
2,
Kani sir?
3.
Since makaroon mo sir, di na ako mudulog kuan. So, karon sir is may mo sir, yung signal ko mo na hand gesture. Iingon na nimo asa siya naka-point, okay?
Okay.
Si, kasi sir, kami nakatudlo sir.
No.
Kani sir, kami nakatudlo.
Dito.
Kani sir?
Taas.
Kani?
Obos.
Sige. Sige sir, ako na yung ko ang sugas sir, para makarabal yung mong sugas sir, pagkiingon na lang sir ha. So, makaro sir,
Oh.
diri sir,
Oh.
diri.
Number
9.
9.
Testing the
Okay.
visual fields. Face the client directly at 90 to 60 centimeters or 2 to 3 feet. Then tell the patient to look directly to the examiner eye. Then place the hand over 20 or 2 feet 2 feet apart lateral to the patient's ears. Then move the wiggly fingers of both hands along with the imaginary goals over the patient's head until the patient identifies them. Then ask the patient to tell you the where is the wiggly fingers are. Then repeat at the same action, then repeat the same actions and lower temporal quadrilateral. Sige sir, akong kanin mo mata sir, na sir, if makarabanin mo, if maliw bang kamot ako sir, if makarabanin mo sir. So,
Oh.
klaro? Dito sir.
Oh.
Kaya sir, liyok sir, wala.
Wala.
Kaya sir, liyok wala.
Wala.
Kaya sir, liyok wala.
Lihok.
Kaya liyok wala.
Lihok.
Sige. Maayos sir, yun yun. Number 10. Repeat the same process until you can find the four vision. Sige sir, ako control sir, pero tikas ka mo itong gamiton sir sa right. Ikakagad mo dili. Klaro sir?
Klaro.
Klaro sir?
Klaro.
Dili sir.
Klaro.
Okay? Okay. Inspect the client's eye for alignment and symmetry. Then inspect the eye of the patient for hair distribution of alignment, skin quality, and movement. Then ask the client if her or his eyebrow, if it can be raised up or lowered down. Ask the patient to look up and press the lower lid of the client with your thumb afterwards to assist this sclera. Then inspect the eyelashes ever if there's a distribution or any directions or curls in the patient's eyelashes. Inspect the client's eye and pupil, then inspect the client's cornea and lens for compacity, clarity, and textures. Then shine the client's eye with the pen light to the side of the to the other side towards the eyes and then ask the patient to look straight forward while doing so. Sige sir, tanaw na ako yung mata sir, check na ako. So sit lang tanaw sa ako. Ayaw di ako sa mata. Sige sir, gabit mo ang spot. Sige sir, tanawa lang ang light sir. Kay ako ikuha mong mata. Chikapon. Number 14. Hold an object, neither a light pen or ball pen, about 10 centimeter in the patient's nose. Then ask the client to look the top of the pen. Then instruct the patient to alternate the gaze of from near to far object. Then observe for the pupil reaction. Sir, tanawang ballpen sir for shadow si Mua niya. Pag pumangkang ano mo, may ko si Mua na tanawang ballpen, then tanawang mong likod. So, tanawang ballpen sir, then tanawang likod. Then tanawang ballpen, tanawang likod. Siya ako na dulo gamay sira, gamay-gamay sa mong ilong na pet. So, tanawang ballpen, tawag yung likod. Okay. Sige sir, akong spatay mong naong sir, mo reflect ba ang duha ka mata sa hayag? So far okay na. Sige sir, tanawa ang ballpen sir na muliyok sir niya. Muliyok ko sa left and right. Imong liyok sir is imong mata ay na pag liyok sa imong ulo, ay na pag left and right sa imong ulo. So 3 si tanawa ang ballpen sir and ako na move. Okay. Number 15. Summary and closing phase. In summary, discuss the patients the result of the eye examinations, and for the closing phase, give a proper goodbye to the client. So sir, so far sir, is imong mata is okay naman walay problema. Ang imong visual sir, imong panan sa imong right nimo sir is 20 which is okay ra pod. Ang visual nimo sa left naman pod is 320, okay ra pod siya tanan. Then imong visual field, so yung upper is 50 degrees which is makaroon nimo which may normal normal eyesight sa pag ang normal panan sa katao. Then ang imong down din mo yung is 30 degrees which is normal na gyapon. Og then imong visual infection sir is imong kilay pit is so may kirang imong kilay musakan imong kilay nimo ug maubos imong kilay. Then si imong eyelashes kay walay curly siya so kira pod. Then si imong lateral naman pod di man dili dapit si imong kilid nimo is okay lang, wala man po nagubag, wala man po siya naglagon. So far so good, okay pa. As long bilar ka, kung siya bilar mo mubag na siya mulagom, pero so far karon wala man karon so okay ra. Then now din sa imong konjomya is kira pod siya og imong eyelash ug imong pupils. So since gay na to pag spot gay na ni-reflect man ang light sa imong ni-reflect man light sa imong mata, then imong mata naman is light brown, imong pupil mo is light brown ug puti imong sa imong mata kilid. Then I guess muna siya sir, okay na sa tanan. Since okay na tanan sir, so salamat tanan sir, o mga tanan sir, ang gusto na sa imong mata.